Welcome everyone to the 2021 Huang Fellow Symposium, The Struggle Between Fact and Fiction, Multidisciplinary Perspectives on COVID-19 Vaccine Misinformation. So first, a couple of things for housekeeping. One, I don't believe you all have the ability to unmute yourselves if you're an audience member, but if for some reason you do have the ability to do so, please keep yourself muted until the question and answer session. For a quick rundown of the schedule, from 1 p.m. to 2 p.m., we'll have the keynote followed by a question and answer. We'll have a short minute break. And then from about 2 p.m. to 3 p.m., we'll have the panel. 3 p.m. to 3:15 p.m. will be the question and answer specifically for the panel. And then that is the end for everything scheduled for this symposium, but we'll still keep the call open from 3:15 p.m. to 3:30 p.m. in case anyone else wants to have further discussion. So now I have the pleasure of introducing Professor Dietram A. Schofela. Professor Schofela is the Tyler Bascom Chair in Science Communication and Vallis Distinguished Achievement Professor at the University of Wisconsin-Madison and in the Morgridge Institute for Research. And he is a Distinguished Research Fellow at the University of Pennsylvania's Annenberg Public Policy Center. He completed his PhD at the University of Wisconsin-Madison in mass communications with a minor in political science. He's one of the most widely cited experts in science communication, political communication, and science and technology policy, having authored and co-authored over 200 articles and monographs. He currently co-chairs the National Academy of Sciences, Engineering and Medicine's Standing Committee on Advancing Science Communication Research and Practice. And he serves on numerous other committees, including the Division of Behavioral and Social Sciences and Education Advisory Committee, the Board on Health Sciences Policy, and the Division on Earth and Life Studies Advisory Committee. In 2014, he was also elected a member of the German National Academy of Sciences and Engineering. Professor Schofela has also provided consulting services for DeepMind, Porto Novelli, PBS, the World Health Organization, and the World Bank. And so with that, I'd like to pass it off to Professor Schofela. Please give him a warm welcome.
Well, thank you, first of all, for that very kind introduction and for having me. It's always great to be, even virtually, back at Duke. And I made the mistake, just as a preface, of coming to the office for the first time in a while. And so I'm having this big screen that unfortunately doesn't show chat windows and attendee windows separately. So at the moment I start sharing my screen, which I will try to do now, I actually won't be able to see you guys. Just make sure that I share the right screen here as well. Here we go. Hopefully, actually, I can't see you on the right-hand side. What I was hoping to do today is to talk to you a little bit about and informing, hopefully, the panel discussion that I really apologize for only being able to make part of as an audience member, because I have another talk coming up this afternoon. But before I start, I want to quickly point out that just this past week, PNAS, the Proceedings of the National Academy of Sciences, came out with a special issue on misinformation in the public sphere. A lot of these articles were written during the pandemic and speak to the topic that you guys, I know, are struggling with and dealing with for this meeting and for this very timely, obviously, and an important meeting. But today I want to hit 5 points really quickly and hopefully leave enough time for you to tell me all the reasons and all the areas in which maybe my analysis is either simplistic or even plain wrong. If you have questions in between, feel free to just throw stuff in the chat, which I can see now, and happy to field questions throughout and certainly at the end. Let me go back here. So I want to start really quickly with that term of an infodemic, which the World Health Organization put out and then everybody just gobbled up and took for granted. And I want to take a little bit of a more differentiated approach to that. And in particular, along 4 different dimensions. One, the idea that we're actually in a very funny spot or not funny spot during this pandemic, where we need to correct misinformation that we know to be out there and that we know to be wrong with science that we're not quite sure will turn out to be right, and in many cases hasn't turned out to be right. That, of course, is exacerbated by human nature. Many of you, certainly everybody on the panel, but also many of you in the audience will know this. that human nature doesn't help in terms of how we look at facts. Even if we got the correct facts, it doesn't mean that we interpret them in ways that is in line with everybody else. And language, certainly during COVID, hasn't helped. The way issues have been framed along partisan lines and other issues. And then I want to end with the idea of what we have in a piece in Slate and Issues in Science and Technology called the accelerated wickedness of the problem, meaning it's of course not just a clear-cut scientific issue, COVID is, but there are lots of other issues around it that further muddy the waters when it comes to misinformation. But let me start with a pandemic, and this infodemic rather, that the World Health Organization has talked about. And typically when you read introductions to articles, very often in the social sciences about COVID, there's a lot of talk about how this is going to undermine public trust and how all this misinformation that's going around, it's undermining public trust. And there may be some truth to that, certainly when it comes to CDC, FDA, and other mission agencies. But on average, when it comes to trust in science has not just not declined, it has actually increased slightly. And that slight increase comes largely from liberals, absolutely. So there's definitely partisan gaps. But we're only second to the military, and the graph that I'm showing you here between 2004 doesn't actually show the 2001 jump. So this is right after 9/11 when the military pulled ahead of science. But we're the second most trusted institution, certainly far ahead of journalism, of Congress, and everything else. So this idea that trust is declining, even during the Trump years, the first 2 Trump years, where we have data from the General Social Survey, just doesn't seem to bear out. Number 2, are we seeing more misinformation for COVID-19 and for other issues and for politics and for everything else? And again, that's an open empirical question, and it certainly seems that we're seeing more, but we're also all spending most of our time at home in front of social media. And I'll get back to that question at some point, if there's really more or less. And then finally, and this is the most important question, we are focusing on misinformation, but there is limited data that suggests that misinformation on COVID-19 is actually correlated to important dependent variables, meaning are we wearing masks? Are we hesitant about getting vaccines? Are we physically distancing, and so on and so forth? And knowledge seems to be certainly a little bit of a driver, but there are many more important drivers. So the social scientific answers to most of these questions is either no, trust is not declining, or we don't really know yet, and we're basing interventions on a lot of assumptions that may not be true. Most importantly, and many of you have seen the Plandemic movie, of course, or have at least heard of it and read about it. But the idea that we're now saying, well, these conspiracy theories, it's a particularly urgent problem during COVID. It is an urgent problem, absolutely, but it's also not a new problem. We've seen this for every disruptive event in the US, including 9/11, where our belief systems, everything that we thought was true is fundamentally disrupted by the economy shutting down, by things happening that we've never seen happen before. And there are great experiments in the 40s by Fritz Heider and other attribution theorists, of course, that gave people these shapes that are largely meaningless and asked them what they're seeing. And most people, the moment we're seeing something that we don't understand, we're attributing causality, we're attributing intention. And this is exactly what's happening during COVID-19. Does that make it good? No, but it makes it not very surprising. Of course, we're trying to attribute meaning, and we're trying to establish causal links between things that don't exist and fill in the gaps of what we don't know with what we think is true. The problem with that, of course, is that science is in that spot, and I already alluded to that earlier, that science is in a spot where we are asked to correct misinformation that we know to be wrong with science, that we knew from the get-go wouldn't be right. Ivan Oransky and Adam Marcus co-founded Retraction Watch, a website that looks at scientific publications that have been retracted. So these are not things that have been proven wrong at some point by bodies of literature, but things that probably shouldn't have been published in the first place, which is why they're being retracted. Back in April, or in March rather, of last year, they wrote a piece where they basically said, look, we're going to do a lot of research on COVID, and really quickly and under immense public scrutiny. And a lot of it is going to turn out to be wrong. And as long as we're prepared for that, we're fine. But I don't think we were. And this is the last sentence was my editorial comment on it. I don't think we were ready for that. And of course, mask wearing was a great example of that, where in the beginning, the CDC came out and was a little bit sense of mixed signals. I'll come back to that, why that was the case. But basically said, look, we're really worried about people not having, especially first responders and emergency personnel and hospitals won't have enough protective gear, so people shouldn't start buying up all these masks, and then pretty quickly changed their stance on this and said, no, mask wearing is actually important. You should wear cloth masks rather than buying up against all the medical grade masks. But of course, and they largely based that on the idea that there was asymptomatic or rather pre-symptomatic spread. And then the World Health Organization, of course, came out a little bit later in June and said, well, that asymptomatic spread is actually very rare. And that's not really what they meant. What they meant is it's really hard to document. But what most journalists read it as is, well, if that's really so rare, why are we wearing masks? And of course, the moment it lasted about 2 days, where utter confusion reigned. And then the World Health Organization walked that right back and said, well, that's not what we meant. But by that time, of course, the genie was already out of the bottle. And this is, I put this one up mostly because it's an awesome cover of InStyle magazine, but also because Anthony Fauci gave a talk in an interview in InStyle magazine in this issue, where he basically explained what the policy storyline was, right? Where he said, look, in the beginning, we were cautious because we didn't want to use up all the PPE for general population use. But then once we realized when the science became more settled, we pretty quickly changed our recommendations. Of course, by that time, already science was in an all-out battle, or scientists with one another. And again, this is what made COVID so unique. Normally, a lot of these battles of different sets of studies in science plays out behind closed doors in the ivory tower, and plays out without a lot of public scrutiny, and plays out in a much slower time frame, or in a much longer time horizon, rather. This time around, it played out in the New York Times, and of course that was not lost to many commentators, especially on the conservative side. Laura Ingraham here saying, well, the next time they tell you to trust the science, look at all the data that they're using that is either faulty, that has conflicts of interest built in, or that they had to walk back afterwards. And I'm just moving away from the title and the mask wearing here. AstraZeneca, of course, is right now in exactly the same spot. I grew up in Germany, which is at the center of some of this controversy, as you will see in a second. AstraZeneca, where the Europeans came out and said, look, there's absolutely no evidence that would warrant not giving the vaccine related to blood clots. So it's safe to do that. About a month ago, a couple of days ago, Angela Merkel, Chancellor of Germany, came out and said she would actually get vaccinated, or she said she will get vaccinated with AstraZeneca. And of course, the exact same day, or a day plus minus, Denmark said, absolutely, we're not using this. We just don't think it's safe. We're going to permanently stop using it. So again, the science, even on vaccines, is emerging as we're rolling out vaccines and are putting shots in arms. That is not an indicator of bad science. That's actually an indicator of the scientific process, but it's an indicator of a scientific process that plays out again with breakneck speed and under immense public scrutiny, which is, I think, what makes COVID one of the trickiest issues of science communication in a long while. The third aspect, or the second rather complicating aspect here, if I talk through the bottom 4 bullet points, is human nature. It's just the way we all function. And I apologize here for some of you. This will be something that you know, but I wanted to make sure that we're all on the same page. The idea of motivated reasoning, not a new concept, something that's been around political psychology for probably 4 decades easily. But it's really, really important in this context. And what it says is not that we select information that fits what we already believe. That's selective exposure, that's Festinger, that's research in the 1950s and since then. What it says is, even if we agree on the facts, and this is where the theme of this meeting is interesting, right? Even if we agree on the facts, we know these facts are true, then all of us will still weigh facts more heavily that fit what political scientists call our priors, our belief systems, our religion, our ideology, what's meaningful to our political or social identity. And as a result, we take new facts and we make them fit into our belief systems. We don't change our belief systems based on new information, but rather we do the opposite, which democratically, of course, is deeply undesirable. I mean, ultimately, we do that to protect our tribal identities. And this is a picture from the week, a cover when the mask controversy, or rather the politicization of mask wearing first emerged, where this becomes a way of signaling on both sides of the political aisle of where you stand politically rather than a public health issue. And again, when I say both ends of the political aisle, some of you may raise eyebrows and saying, well, no, this was largely a conservative problem. But yes, it's true. But the idea of sharing or of believing in misinformation and motivatedly reasoning our way into or out of that is not a partisan issue. These are two examples that both ended up on my Facebook feed, shared by academics with PhDs. On the left, this alleged conspiracy theory of people adding up random numbers and making connections to COVID-19, which of course is a doctored photo. And then on the right, a tweet that I just checked today has 700,000 likes and 100,000+ retweets that Trump said that hundreds of governors were calling him, and we only have 50. Let that sink in. And of course, the answer is, why am I not checking on this? And the answer is because I want it to be true. Because if I'm a strong Democrat, I think Trump is probably not particularly smart, and so this must be true. And so it's really the motivation that is the driver here, rather than the ability to spot misinformation. To the point of motivated reasoning, this is data from May of last year, when really COVID started kicking in and the death rates shot up, and the government was releasing official numbers. So this is not a question, do we know these numbers or not? Do we understand them or not? Are we informed or not? The question is, do we believe them? Do we motivatedly reason about them? Here's Democrats. 2/3 of Democrats think that these numbers are not large, that they basically underestimate the problem. And with comorbidity and other things, there are reasons why that may be true. But you have 2/3 of Democrats saying, well, those numbers are probably not capturing the full problem. And you have a relative majority, 2 in 5 Republicans that thinks that those numbers are exaggerated. So where we are is, with both sides of the political aisle not believing official government numbers because it doesn't fit their political narrative and their political priors. At some point, and many people have tried to counter this. Phil Tetlock at Penn has done social accountability work. Others, when I spent some time at the University of Pennsylvania a few years ago, and this was just when the Pope was around. We figured that this was actually one of the opportunities, one of the really exciting opportunities, to see if there is a way of basically making information that might be incompatible with people's priors, with their identity, and therefore may lead to disconfirmation biases, or to confirmation biases in either direction. If we had a conservative spokesperson who would actually connect an issue like climate change, in this case, to conservative values, could we work around motivated reasoning? And so the Pope happened, as some of you will remember, happened to come to the US. And right before he came to the US, he released an encyclical in which he basically said, not only is climate change real and caused by humans, but we need to do something about it. It requires us to get involved and to combat global warming. So perfect, right? Here is the message that we're trying to get across that conflicts with priors, but hopefully the Pope saying it as and again, the Pope has a very specific denomination, but it's generally perceived to be a more conservative spokesperson. This was what Philadelphia looked like when the Pope came through. This is, you can see just as he's driving by, and people see him on big screens just a couple blocks away, and you see this elderly lady in her chair, and even cops and people taking selfies. It was an event that really brought people together. So what we did in surveys, and when I say we, this is Kathleen Hall Jameson and colleagues at the Edinburgh Public Policy Center. What we looked at is, on the x-axis, you see basically people in surveys and ranked from very liberal to very conservative. And then on the y, you see their climate change concern. And the black line is or the black lines rather, basically the relationship line here among people who were aware, the red ones among who are unaware. So unaware means you haven't seen the encyclical. And not surprisingly, Republicans are lower than Democrats, right? What we're hoping is that as people get aware, meaning as they turn from red to black, that line becomes flatter. Why? Because all of a sudden conservatives actually realize that climate change should be of concern because they've been told by the Pope, a conservative spokesperson. The exact opposite happened. Polarization became even stronger when people heard from the Pope. So what's going on there? And one of the things that we then did in the second round, we looked at, again, it's the exact same distribution here, liberal to conservative, but then asked, is the Pope a credible messenger? And again, if you look at the unaware people, meaning people who hadn't read the encyclical, Democrats saw the Pope as a slightly more credible messenger on climate change in particular. That's what we're asking on this credibility dimension. And once they've read the encyclical, again, the polarization became even worse, and conservatives basically said, well, we don't think the Pope is a credible messenger. So this is how powerful motivated reasoning is. We adjust our views on the Pope, and this was actually the narrative that the Pope is a socialist and therefore not credible as a conservative spokesperson. This was a Fox News talking point. We'd rather adjust our view on the Pope as a credible messenger on climate change than to change our views on climate change when being faced with a set of information that doesn't fit our priors. This is how powerful the phenomenon is for both COVID and everywhere else. And the third part of all of this, of course, was the emergence of tribal language. And many of you have seen this picture. This is Donald Trump with one of the transcripts of his speech. And you see COVID being crossed out, replaced by the corona rather being crossed out, replaced by the word China. So the China virus. And there are obviously political reasons for doing that and speaking to a particular, to put it euphemistically, more nationalistic part of his constituency. But it highlights, of course, something really important, and that is that language has always mattered in how we talk about, in how we interpret complex science, COVID not excluded. Daniel Kahneman won a Nobel Prize in 2002 for his work in prospect theory and behavioral economics, and for basically creating the field of behavioral economics, which is psychology in business schools. But his work started out with an experiment that's actually eerily similar in its wording. And again, this is wording from the 1980s, mind you, but where he's asking about an unusual Asian disease, which is expected to kill 600 people. And of course, he then put people into experimental groups that were framed in two ways, that were described in two ways. One was a gains frame, so people will be saved. And then one was a loss frame, people would die. Quantitatively, the two conditions describe the exact same thing. 200 out of 600 will be saved, or 400 out of 600 will die. So there's no difference except for one is framed more as gains, more positive. The other one is losses. And as you can guess, the results are strikingly different, where people are much more responsive to a gains framing of a problem than to a loss framing when it comes to policy interventions and other kinds of potential solutions. That research, among other bodies of other research in linguistics and sociology, led to that whole idea of framing. Why language is so important in setting frames of reference. And Kahneman and his colleague Tversky, who had passed away by the time Kahneman won the Nobel Prize, so he wasn't eligible. But basically, they built a lot of their work on research from the 60s at Harvard on the broken B, what's called the broken B stimulus, which is really kind of this perfect illustration of what COVID looks like, right? I can look at COVID from many different perspectives, and it really depends on what my frame of reference is: economic, public health, and so on and so forth, individual rights, whatever it might be. And so what they showed is that I can basically set people's frame of reference and get them into a mode of information processing simply by embedding such a broken B stimulus, an ambiguous stimulus, into a sequence that would make it more, or a frame of reference that makes it more or less likely to be interpreted in one way, letters, or in another, numbers. So that's kind of where framing comes from. Can I describe particular issues in ways that resonate with an underlying mental schema and therefore make one interpretation more likely than another. And you can already see why that led to a Nobel Prize in economics and the application in business. But framing is not just a tool for leading policy audiences or any other audience to a particular conclusion. It's a central part of how we process information. It's not just a tool, it's a process. It tells us why we should pay attention. Conflict framing tends to dominate media coverage because it gets attention from all of us, because we know this is something that we should be paying attention to. It tells us why we should take particular risks around stem cell research or around CRISPR, new genome editing techniques, why the benefits in which an issue is framed, or toward which an issue is framed, outweigh the potential risks. And more importantly, it connects, and this is really where framing is so powerful, it connects science that we ultimately don't understand in all its complexity to things, to mental schemas, mental ways of interpretation that we have in our minds, values, beliefs, priorities that matter. And The Economist and others have written extensively about, for example, an economic framing of COVID. Yes, mask wearing is the right thing to do. Yes, there are public health arguments, but more importantly, there are economic arguments for a lot of the folks who may not necessarily respond well to a public health argument. The idea that every person not wearing a mask per day costs us $56+ in GDP down the road may be a much more powerful argument. So you set the frame of reference in an economic question, which may matter much more to a conservative audience. Most recently, some of you may have seen this, the question came up of vaccine passports. If you think about framing, right, what are we speaking to here when we use the word passport? And of course, the US, and this is still very funny for those of us who are from other countries and didn't grow up here, there's a deeply ingrained distrust of national ID cards and passports and so on and so forth, certainly things that are required. And that's not any different for COVID. Frank Luntz, who is a Republican pollster, has written a piece with a public health scholar where he argued that that's actually a really bad term. The passport terminology and or framing is a really bad way of describing it. Why? And I would urge you to look at the middle part here, if I can move my mouse, right here, the idea of vaccine passports being yet another example of government overreach in Washington, already knowing and having too much control over our lives. And here's the percentage difference between Trump voters in red and the overall sample in gray or blue. Here's ultimately what they tested then in surveys. What are the names that would work really well? And the argument that they're making in this piece, and I think that's a somewhat convincing argument, that vaccine verification is a much better term than a vaccine passport because it avoids some of that partisan polarization that we're getting out of the passport language and gets a much broader set of buy-in. That also corresponds really nicely with findings that Jamie Druckmann and David Lazar and his team and their team, and I'm leaving out a couple of people right now whose names I should remember but don't come to mind, who have this 50-state survey on COVID and have also tested different ways of combating vaccine hesitancy, and find that a patriotic frame, that's the patriotic thing to do, is actually one that works really well and helps close those partisan gaps that we're seeing on vaccine hesitancy. So let me just, and as I keep looking over to my phone to make sure that I'm leaving enough time for Q&A, because I really do think there's lots of stuff here to disentangle, and I'd love to hear everybody's take. I want to end on this idea of accelerated wickedness. As I mentioned earlier, this goes back to work that I've done with colleagues in the department, Nikki Krauss, Isabel Freiling, who's now at the University of Vienna, and Dominique Broussard, our department chair in communication, where we wrote, look, this is not just a wicked problem in the sense that it doesn't have a best case scenario outcome where we know there's one clear-cut solution that we need to work toward. We know that we need to balance different things: economic considerations, individual liberty considerations, public health considerations, and so on and so forth. And the mixture, the trade-offs between them are not clear. There have to be politically determined, and as we've seen throughout the world, different countries have taken very different approaches, some of which I would argue are equally good, even though they put a slightly different formula together, or equally bad, even though people have put the same formula together. But a lot of that work also overlaps with work on what's been called post-normal science. And I want to throw out COVID, or the notion, or the argument that COVID is actually a perfect example of post-normal science. And so what some people in the science technology studies literature have argued is that scientific issues, at least partly, can be defined along two lines. One is how much systems uncertainty there is, meaning how many different factors in the social and political and scientific system are affected by this, and how well can we predict them? And then how high are the decision stakes if we get stuff wrong? And I would put the steam engine probably in the area of broadly applied science. Did we get a lot of things wrong with that in terms of unintended and collateral societal effects? Absolutely. They're played out over generations, and we're still paying the price for some of them. But again, they were somewhat slow moving, and we could have at least had the time for interventions. We chose not to. And we can say everything from climate to industrialization to urban sprawl. You can throw in hundreds of issues that came out of this, but ultimately the decision stakes were manageable. The uncertainties, again, they were there, but they were manageable. The second, and I'm putting them here chronologically, even though they're really classifications that are not that are still true today to some degree. But if you think about the Manhattan Project and scientists really starting to get involved more and more in the idea of advising the government, decision stakes, obviously, for the Manhattan Project were much higher. Also the uncertainties, which is why chemists and physicists and other scientists wrote a letter to the president saying, look, we need to have the Manhattan Project because this guy from Weizsäcker is building the nuclear bomb for Hitler, and then wrote another letter when they were close enough saying it's a really bad idea to drop those bombs. This was a letter written obviously before Hiroshima and Nagasaki. So you can already see where the uncertainties and decision stakes go up. This is where we're now. I just put CRISPR here, new genome editing techniques that allow us to make both somatic but also germline changes that are going to be inherited, both therapeutic, but also then of course bleeding over into human enhancement, and raise a whole host of ethical, legal, regulatory, policy questions that have absolutely nothing to do with the science itself and everything with the policy dilemmas that we face. And I would throw COVID in there. I don't know what you guys do in the research triangle, but certainly Wisconsin, we have our contact tracing app, right? And I'm carrying around 2 phones now. One is issued by the university because I don't want to have a contact tracing phone on my app on my own phone. But I can't get into a building even without having a green badge that either means I'm vaccinated or I'm doing a PCR test every week if I'm a faculty, or every 2 weeks if I'm a student. That phone also will send me an email, or the university will send me an email if my phone runs out of battery or is not connected. And like, well, so this already tells you where the surveillance is and how much data we're actually collecting. Both iOS and Apple, Google's operating system, Android, changed their operating systems to allow contact tracing during COVID-19, with huge implications for privacy, for everything else, because how we roll those things back after COVID is over, and COVID will never be fully over, but after the urgency goes away a little bit is a whole different question. Ron Wyden said this, Senator said this after 9/11, we need to revisit things like the Patriot Act in less panic times, I think was his argument. And we have very little of an exit strategy when it comes to COVID. We also had very little awareness early on when we implemented things like social and physical distancing. This is data from the New York Times. It's not, I intentionally didn't blow this up because it's just the difference between the kind of the orange and the blue lines, where you see not just the degree to which populations lower socioeconomic status in orange and higher socioeconomic status in blue could socially distance, stay at home and work from home, but also how quickly they could do it. And this was not by choice, of course. This is simply the types of professions that people work in. So as we're implementing some of these solutions and public health interventions, they're on the one hand much easier for some populations, and B, as a result, put other populations much more at risk. Again, does that mean we shouldn't do them? No, but it means that we have side effects that we really need to deal with, and collateral damage to already vulnerable populations. And I think we figured that out as we went along, and sometimes we got it right and often we didn't. Ultimately, and this is, I want to end on that, the pathways forward. There's been a lot of discussion and a lot of celebration when Biden came in and said, well, finally, policy is going to be, it's going to follow the science again. And I'm going to push back on that, not just because I want to be controversial, but policy has never exclusively followed science. We know that we could lower the speed limit by 10 miles an hour, and thousands of people would be saved and wouldn't die. It would also take me 7 hours to get from Madison to Milwaukee. I mean, not 7 hours, but it would take me a lot longer than I'm willing to spend. So we're constantly making policy decisions that trade off individual rights and other considerations, economic and convenience, against scientific facts. We know that if none of us drank any alcohol, cancer rates would go down dramatically. But we're not going to ban alcohol. That's just not going to happen because, again, we're weighing different things. And Fauci said this very early on in the Trump administration, where he said, I know that my job is not to determine policy. My job is to get the best available science so policy can take it into account. And I think that's a really important distinction. Policy is called policy for a reason, because it's made by the people, not by science. But how do we make sure that we do what Fauci was arguing? And I think number one is language will matter, if we like it or not. I think the vaccine passport example was a really good example from Frank Lentz. This is work just to show you really quickly how ridiculous this sometimes is, that Howard Kunreuter and others have done at Wharton, where they showed that if you sell a light bulb, an environmentally or an energy efficient rather light bulb, without any explicit label, just kind of neutral blank label, there's actually not much of a difference between liberal conservatives and their willingness to purchase that compared to other light bulbs. Once you throw an environmental label on it, you can completely see that line change, and liberals get really excited because the environment signals to them that that's their tribe, this is what they're supposed to do. And it signals to conservatives that this is not for them because this is a value that just is at odds very often with where their political stance is. So it's almost a gratuitously problematic way of making sure that you split the consumers into two groups that won't buy a product that otherwise they would have been just fine buying because you didn't think about the language of it. I already said the value propositions that we're making for some of the interventions, I think we've often based on science. And if you watch CNN, they've been celebrating this to the nth degree, saying, why don't people follow the science? And everybody who's not following the science by definition is not part of the tribe. And I think there's, of course, as somebody from within the scientific community, I very much agree with that. But that's not the best argument to reach audiences for whom that's not an inherent value, or for whom other values outweigh the value of the science. For example, their livelihood, if they run an independent business, and so on and so forth. And again, this goes back to the economic argument I already made earlier. The last two that I'll mention, one is we have not been, and this goes back to Ivan Orensky and Adam Marcus's argument, the idea that we're providing the best available evidence that we have has been difficult to convey during COVID, when that best available evidence kept and keeps changing to this day. And there are models for us actually making that argument really well. And I put chemotherapy here as one example. Chemotherapy is not a good way, an ideal way of treating cancer. Right? And we still use it for some cancers, absolutely. But for the lack of a better description, it basically poisons your body, hoping that the cancer dies before you do. And that's a horrible value proposition from science. But we also know that this is just because we have nothing better right now. But we also know that we will have more targeted delivery, drug delivery to tumors, gold nanoshells, whatever else, lots of different ways of personalized medicine that will make chemotherapy obsolete at some point. COVID is not that different, right? At any given moment, we knew more than we did before, but we knew that we didn't know everything yet. But we basically said, well, that's just, we know this, and so therefore you should follow the science. And the answer is, well, we know this right now. This is the best available science right now. And science is working on getting even better at this. And we never really framed it that way. And I think we're paying for that. We're paying a price for that. And we may be paying a price for that in the long run in terms of an even more pronounced partisan split along when it comes to supporting science. And then the last thing is a more optimistic note. This is our department chair, Dominique Broussard, talking to JAMA about how we actually can change behaviors in ways that have very little to do with misinformation. And if people don't understand or even incorrectly understand the science of COVID, or let's say mRNA-based vaccine platforms, I don't actually care as long as they go and get vaccinated. To get them vaccinated, very often some of the exact same biases that I talked about here, everything from motivated reasoning to social norms and other things, may be very powerful mechanisms to change behaviors. Normally, if I were in Durham, I would probably be in front of you with a suit and a tie. There's no rational reason for doing this. The only reason I would wear a tie is because it sends some heuristic that I take this seriously and I'm credible. The only reason I'm wearing a tie is because one does that. Everybody else does it, right? And so we constantly do stuff because other people do it. We constantly change behaviors because other people are changing behaviors. And so some of the exact same things that make us do stupid stuff also can be very powerful mechanisms. And I think reliance on the social sciences more and more, and on systematically relying on bodies of literature from the social science, is something that we haven't done as much during COVID. And I think we're paying a price. And hopefully we've learned lessons moving forward that we need to put structures in place. And I know that you guys in the Science and Society Initiative are doing that already, very, very, very structurally. Certainly at Wisconsin, we have some of the same or similar structures. So I'll leave it at that with a call for more of that. And thank you so much for letting me put out what's hopefully somewhat controversial or controversial enough to trigger a good discussion. Thanks so much for having me.
All right, thank you so much, Dr. Schiffler, for your talk. Now we'll have the first Q&A session. Just looking at the Q&A, we have several great and stimulating questions. The first one comes from Sophia Lehman, and it reads as follows. She says, you mentioned that science communication often requires us to share information despite not knowing whether it is true, in order to prevent the spread of information which we know to be false. How do you approach this ethical dilemma as a science communicator, and where do you draw the line?
Yeah, a really good question, and I don't think I have a necessarily a definitive answer on that. But I think two things, and one goes back to one of the last slides, and that is being very open about this being the best available evidence we have right now, and how hard the scientific community is working on improving that evidence and building even a broader evidence base is really, really important. And so I think that's both important in terms of maintaining public trust and getting good societal outcomes, but it's also, I very much appreciate the point in the question about the ethical dilemmas. And then I think the second aspect that I don't think it was maybe in the question, but I would add it to it, is also the question to which degree I'm asking, can I ask for behaviors based on data that I don't know is completely conclusive yet? And this could be in the area of vaccines, it could be in other areas, but where I as a scientist need to be, especially if I'm influencing or if I'm informing policy, need to be very explicit in terms of what the potential pros and cons from a scientific risk assessment perspective are of policy actions moving forward. Roger Pelkey Jr. has written a really good book called The Honest Broker, where he talks about kind of the opposite of the honest broker, kind of describing the scientists as honest brokers. And one of the things that he's saying is there's a real danger for us as scientists to become what he calls stealth advocates. So where we're advocating for certain outcomes by leaving out other policy choices that would very much be in line with the available data. And so especially in areas where the data is in flux, I think that's a real danger. And so for all of us to make sure that we don't become stealth advocates for something that we really want as citizens, when we speak as scientists is I think a fine line to walk and place into that ethical dilemma that the question raised. So a really good question. Thank you for that.
Great. The second and third questions come from David Berube. His first question is, well, not really a question. He'd like you to speak more about zero risk bias and breakthrough infections.
And I'm not sure that I know, and I know David really well, so hi, David. I don't know if David can provide me with a little bit more context of what he wants me to talk about. I don't know exactly what he's asking. I don't know if David, if you can unmute yourself. If not, we can talk offline. Apologies for
Can you hear me?
I can.
Yeah, you know, zero risk bias, where people want everything solved for them, and then breakthroughs from our people who currently have been vaccinated, and the impact this has on hesitancy.
So I'm still not sure that I see the connection between the bias and people being vaccinated. What are you asking? Sorry for being
when you have
super
a
dense, David.
Someone's been vaccinated, but they catch the disease, right?
Oh, I see what
right.
Yeah, I see what you're saying. Well, I think so. Again, I would slice that in two directions. So one, we have the and this came with Bell's palsy. There were a couple of concerns early on based on 3 cases that were in a clinical trial. And so this is not getting to your question on vaccines yet, but this was this was the trials for the vaccines. And so we're being extremely careful right now, and we're seeing the same thing for the Johnson & Johnson vaccine. 6 cases here, 3 cases here. For the 3 cases, it was pretty striking. With the 4 cases, because I think it was 3 in the treatment and 1 in the control. So you can really see 1 case even going over. So we're being overly cautious, but we're being overly cautious again in a scenario where we're under immense public scrutiny. And so I think there's a trade-off between being overly cautious publicly and undermining confidence in vaccines when, again, we're talking about a small number of cases, and at the same time being prudent for a lot of vaccines that still operate under emergency authorization rather than full approval. The people still getting sick, I think that's yet another one. And this is personal editorial comment, so please take it as that. I think one of the things that we haven't done particularly well with vaccines is actually talk about the dual purpose of vaccines. We're talking a lot about individual efficacy and what it does to individuals, but of course that efficacy depends heavily on the people that you're running into and if they're vaccinated or if they're carriers of the virus, depending on what vaccines do or don't. So the idea of herd immunity really depends on what the social structures look like and what the individual vaccination looks like. And I think that's something that we haven't really gotten across very well. So this idea, if you're the only person vaccinated among 330 million Americans, all of whom are not, your chances of getting sick are still pretty high. I mean, relatively speaking, certainly much higher than if everybody got vaccinated. And I think that's another one that we didn't get across particularly well. That doesn't speak to your question, well, how do we deal with cases of people still getting sick, even though they've been vaccinated? I think that's one that in that larger set of explanations would be covered, and we just haven't provided those. We've really focused very narrowly on individual efficacy, and I don't think, or efficiency, and that I don't think reflects the nature of the problem or is particularly useful science communication wise.
Great, thank you. I see that David has another question that he typed into the Q&A regarding how pauses in EUA affect hesitancy. Do you want to speak more about that, David, by like what you mean, or shall we move on to another?
He answered it.
Great, wonderful. So we have another question from in the Q&A that talks about vaccine hesitancy in the African American community. They'd like you to speak more about that.
Yeah, and this is something where we've seen. I think earlier when I talked about things that we didn't necessarily, that we should have seen coming but didn't see coming, that's certainly one area, not just vaccine hesitancy, but also certain groups being disproportionately affected by other types of interventions, including social physical distancing and so on and so forth, or to basically self-isolate. A lot of studies on lower socioeconomic groups. If you have 5 people in a 2-bedroom apartment, to isolate it is really not that easy. And so there was a lot of concern early on vaccine hesitancy, especially for those among those vulnerable groups. We did actually, as part of the Standing Committee on Advancing Science Communication from the National Academies, we did a webinar, and I think the presentations are still or are available online. This is a webinar for journalists on how to cover COVID. And a number of scholars spoke to the question, and practitioners, people on the ground, to exactly that question. And of course, we have, I would say, two things in particular, one for African-American populations, and then one for also Native American populations, who have actually been very much disproportionately affected by this, but share some of the same concerns. For African-Americans, we very often, I think, and African-American scholars can speak to this and have spoken to this much more powerfully and credibly than I can. But we often refer to Tuskegee and some of the missteps, to put it euphemistically, of the medical community in the past, and that's certainly true, except for sometimes we interpret them wrong and say, well, you know, Tuskegee, they were experimented on. Well, the problem is that they didn't get treatment. So that's actually the key part, is that the lack of trust comes from not being treated. But number two is, it also is way too simplistic, in the sense that if an African-American female goes into a hospital today to give birth, she still has a lower chance of surviving, or she has a higher death rate than a white female. So it's not just Tuskegee a while ago, it's currently in the US, we have different health outcomes across racial lines. And so it's not just a, well, leftover mistrust that we just need to deal with, it's a real disconnect. And I think we saw that when one of the, hopefully I'm getting the journal right, I thought it was a JAMA editor, but it may have been a different journal. So if I'm intentionally phrasing this with the uncertainty, who said, you know, there's no racism in the medical community, and then was put on leave, because of course there was some of the, or no structural racism, because that kind of negates some of those discussions. So I think that's one big aspect, and really working this requires that the burden here is on the medical community and on society more broadly. For Native American communities, one of the things that came up during this webinar that I just mentioned is, and this is a faculty member at Michigan who's herself a member of a tribe there, who said, well, there are real concerns among Native populations that if they get vaccinated, they're going to get the placebo anyway. So yes, you're going to get a shot, but you actually don't know if that's the real shot. So again, I think what this highlights is a real need for public engagement, and for the medical community to not, for all of us, for that matter, the scientific community, to not determine what is best for people, but to, in that policy process, really work with affected communities to figure out where the holdups are, where the concerns are, and what the best pathways are for the medical community to work with other communities in overcoming these toward best social and medical outcomes, for that matter, for those groups. So those would be the kind of the two things I would flag, without being an expert in that area. But I think they're crucially important questions moving forward, because we saw it at every single stage, even on data. So it's not just did we diagnose the problem right. We didn't even have data, or enough data to evaluate in the formative stage different interventions, and so on and so forth. And Vishwanath at Harvard Public Health has talked about this a lot, about the idea that a lot of the data sets that we have available actually don't allow us to zero in on the most vulnerable populations in a way that we need to, and that COVID has just brought this to the forefront. A lot of people knew this beforehand, and like, we told you so, but I think the broad awareness is just now building.
All right, great. Well, we do have several more questions, but since it's 2 o'clock, let's go to our 5-minute break, during which we'll organize the panelists. Thank you so much, Dr. Shukla, again, for doing this and having such wonderful, stimulating responses.
Thank you for having me, and thanks for the great questions.
Hey, so thank you again to Professor Shofala on your fascinating discussion regarding how to better understand the COVID-19 infodemic. So we are thrilled to be bringing together perspectives from medicine, decision science, public policy, and more to discuss and probe why medical misinformation presents such a daunting challenge, as well as the more complicated factors that factor into vaccine confidence and the promising paths forward. So I'll have Megan introduce our panelists and get us started.
Yeah, thanks, Alex. So like she said, we're deeply honored to be bringing in some incredible perspectives to this discussion. So I'll just start by introducing. First, we have Dr. Phil Napoli, who serves as a Senior Associate Dean at our Stanford School of Public Policy. His work centers on digital media regulation, and he's also authored a new book entitled Social Media and Public Interest, Media Regulation in the Disinformation Age. Next, we have Jamie Wood. She's an associate professor at the Duke School of Medicine, and she's also the co-director of the Duke program on medical misinformation, which is an initiative to train physicians in building physician-patient relationships and learning how to address patient-held misinformation. We also have Dr. Scott Hutel, who is the chair of Duke's Department of Psychology and Neuroscience, and whose work has spanned neuroscience, psychology, and economics to better understand how humans make decisions, especially choices with social and economic influences. We also have Dr. Poonam Sharma. She's a practicing physician and a professor at the Duke School of Medicine, where she also serves on the advisory board to the Duke program on medical misinformation. Our fifth panelist, unfortunately, cannot be here today. In theme with the panel, she received her second dose of the vaccine and unfortunately had to cancel for feeling a bit under the weather. Just a little too enthusiastic. But thank you, each of you, for being here. We're thrilled to have you. For these questions, we're going to ask our panelists to try to limit their responses to 3 to 4 minutes, as we have a lot to get through. And we'll propose to generally go in the order that I introduced, but of course, there's no need to stick to that. And please feel free to jump in the conversation wherever you see fit. So I'll let Alex get us started.
So for our first question, we wanted to start out by saying that we know that misinformation isn't a new phenomenon. At the height of the COVID-19 infodemic in May 2020, a Cornell paper reported that 14 to 19% of individuals reported seeing and believing in fake news, which is a number that's more than double the results in a 2016 study. So we wanted to ask, how might your particular discipline help explain why the issue of medical misinformation, especially those regarding COVID-19 vaccines, is so prevalent in our current environment?
I'm happy to go first and kick things off. I'll sort of come at this with 2 different hats. One is sort of my disciplinary background is in communications. I'm a communications scholar, but I happen to be in a public policy school, so I'll put on my public policy hat for part of the answer as well. The first part, I think, an important factor for us to keep in mind in terms of how things have changed is something that's we study a lot in my field, which is this idea of gatekeeping and how our gatekeepers, those individuals, organizations who make the decisions about the information that flows in our news and information ecosystem, what gets through, what doesn't. There are fundamental ways in which our gatekeeping environment has evolved. And one of the things that's important to keep in mind, this is not an environment, it's very easy to place all of the blame on social media, but it's much more complex than that. But if you just look, for example, at the social media model of gatekeeping, it's essentially, and this may be obvious, but it's sort of, almost so obvious that we lose sight of it, that the entire, model of gatekeeping has been inverted. That is, it's not evaluate new information and make a decision to disseminate it. It's a widely democratized model of gatekeeping where something gets disseminated and then retroactively a decision is made based on feedback, whether or not that was information that should be flagged, should be removed, etc. So we've broadened the gatekeeping authority, the gatekeeping ability so much, and allowed it to operate, allowed these large gatekeeping institutions like your Facebooks and your Googles and your Twitters, et cetera, they operate at such an unprecedented scale in terms of hosting each of us as individuals who has our own now gatekeeping authority on these platforms. So it's an environment that's so much more difficult to police for any kind of misinformation than any previous gatekeeping environment has been. So that's sort of on the communication side. And then on the public policy side, we can't lose sight of the fact that at least, we think about the US in particular and our approach to our public policy and our legal approaches to speech it is an environment where our First Amendment tradition has given a tremendous amount of protection, even to intentional and blatant falsity, which certainly sort of constricts. And this may be for the for the better, certainly, but it certainly restricts what kind of government interventions might be possible, even around something that we might think is such a cut and dried public health issue, clear public interest in there being greater ability for government to intervene as it relates to misinformation around something like the coronavirus. So it's a speech environment, a legal environment, a policy environment that is really, really restricted as far as what could potentially be done to correct any of the problems we're currently seeing.
I can go next. I'll sort of come from the basic science perspective. One of the things that's always struck me as I pursued my PhD and then went through my postdocs is how difficult it can be sometimes for basic scientists to communicate with the general public on some of these very complicated issues, and really just sort of how to explain the basic biology behind something like an immune response. And so it's one of the things that I think about now as I am teaching pre-medical and medical students, that as they move forward in their careers, how will they explain to patients who may only have a high school education why they are prescribing a medication or why they are recommending a vaccine based on what they know. And so I was really struck by in the keynote this sort of framing of language and how we talk about things. If we as scientists cannot get better about how we talk and how we teach to the general public about why some of these things are necessary, then that certainly provides a breeding ground for someone else who can do that and spread misinformation.
Okay, so I'll jump in and just, I could echo everything that's been said so far, but I'll try to add something new. So I think it's important to contrast the vaccine current context with some other cases. So you can imagine there are going to be plenty of people who will accept all other sorts of things with modern science and medicine. They will take cancer treatments. They will do things like that, but something with the vaccine acceptance seems very different. And I think one thing we probably get into is this notion of tribalism and what the vaccine says about you to others. And I think that's very different than like a cancer treatment or something like that, which it has clear immediate personal benefits and doesn't have the connections to I'm signaling something about my tribe. And I really think this is important because I think misinformation often is most likely to spread when there aren't as much personal cost from the spreading. So like, for example, people may be much more willing to take a cancer treatment that will help extend their personal life. Whereas if for a vaccine, even individually, people in high risk groups have relatively low personal fatality rates or harm rates, meaning that I personally might get more benefit from building up my social status in my community by acting against masks and other things than I would have harm from COVID. And you might say that that's sort of silly to even think that way, but we know that happens in other contexts. So I think weird thing about this is this COVID is almost like a perfect storm where it's a low risk, societally wide event where people have a lot of other motivations besides just protecting others in their group. And I think that's something we'll probably, again, I expect we'll talk more about that.
There are lots of great comments already said, and I'll try to echo some of those themes from my perspective as a physician. One thing that's striking about this last year is just the tremendous rapidity of change and the enormous amount of information that's come out around COVID. And so trying to keep up with what the latest is and be confident as much as we can in that and try to accurately portray that at times when it seems to conflict with what was recently in the press is quite a challenge. I will also echo this theme about gatekeepers and who is the purveyor of truth or the reputable person to go through. And I think we've seen that play out in how the science is distributed as well. I have never seen so many press releases come out before papers and trying to figure out what that means for the care of patients or what you're supposed to be conveying to people in your community is quite a challenge. I will also echo that tribalism, which has been just striking to me. You know, I have tried to engage my patients in conversations about vaccination. And it's just, as I reflect on it, incredibly rare that someone is undecided about it. People are entering these conversations with very firm views, either, you know, amazing enthusiasm or very set in their decision not to get it. And it's rare to come across a patient who is entering it with a question, which kind of frames how the conversation goes.
Yeah, absolutely. So now let's move a little bit into the vaccine confidence side of things, because most of the time when we talk about medical misinformation, what we're really trying to figure out is how do we get everyone vaccinated. And so thinking about the past year and all of the educational campaigns and community-based efforts that have been working to improve vaccine confidence, we're still seeing that the most recent polling from the CDC and the US Census estimates that around 1 in 5 Americans wouldn't be willing to receive a COVID vaccine if offered one. And so that kind of prompts our next question, which is, what do you think are some of the things that make this issue of vaccine confidence so difficult? And some of those things we've addressed a little bit, but I guess I wanted to start with Dr. Wood and Dr. Sharma, especially with your work trying to bridge these kind of conversations. What have you found to be difficult in practice, and what are the challenges that you're teaching med students to overcome in those conversations?
You can go ahead, Dr. Sharma.
I was going to give you the first word, but I'll give you the last word, Jerry. So I think there are several aspects to it. I think, as clinicians, there are a lot of things we have to counsel patients on. So I think we are hopefully comfortable in entering into that space and figuring out where patients are at and what our shared goals are and doing motivational interviewing. And this is just another example of where we get to practice that skill set. I think the things that make it particularly hard is that it's not just, as you were saying, a decision that affects the patient in front of you, their long-term cardiovascular health and why they should stop smoking, but it affects the population of yourself and your community. And that makes it extremely challenging and tempting to buckle down into your own tribalism and be like, why won't you just do this thing? So being willing to enter into those conversations from a place of compassion. I'll also say from a clinician standpoint, I feel like how you have that doctor, patient-clinician relationship before you have these conversations start around vaccine goes a long way. So if this person in front of you knows that you're invested in your health and that you have shared common goals, that makes everything that follows a lot easier. If the first time you seem interested in them is when you're telling them they need to get their COVID vaccine, I think that's going to be a lot less successful.
One of the aspects in the workshops that we're doing with the medical misinformation program is teaching our physicians and healthcare providers who come that misinformation, that patients bring misinformation not just randomly, that for some reason there's a reason that they've gravitated to some piece of misinformation. And so empathetic listening on the part of a healthcare provider is really critical to, as Dr. Sharma said, trying to build that relationship and trying to also maybe start to detangle some of that misinformation that a patient has. But in terms of the students that I'm teaching, one of the things that I'm really interested in is simply the matter of trying to prepare them for these encounters. And so just by simply, as they're going through our curriculum, having them think through, okay, we're teaching you about how the immune system responds to a virus, but what are you going to do when you have a patient in front of you who says, well, I read X on the internet that says this, which is why I don't need a vaccine. And so I think if we can just start when students are in training, having them be prepared for these types of encounters, then we can start making at least some headway when they have patients in front of them.
Yeah, let me jump in on a different topic. So one challenge that's a little bit hard to understand is why people don't want the vaccine at all. I mean, it's a very quick thing. It's very extraordinarily safe. Probably has the same risk as things like aspirin. I'll defer to my medical colleagues of that. But I mean, this is not something where it's immediate negative side effects for huge numbers of people. But if you think about what things people really don't like when they're making decisions, they want to avoid outcomes that are sure, negative, and in the present, especially if they feel like they would be responsible for it. We push off decisions that involve those sorts of things. And for my sense is that at least some people frame the act of getting a vaccine as a sure negative outcome. I'm getting something bad. You know what? I might or might not get COVID, but that's probabilistic in the future. And so I wonder if one big challenge we're going to have over the coming months is to reframe the choice here. I can speak personally. When I get a vaccine, I felt relief immediately afterward. And I did it because I wanted that feeling of relief. And I felt the safe outcome was the one where I took the vaccine and I felt better afterward. And I can imagine for some other people, they feel like I'm going to regret having gotten the vaccine. And somehow if we can turn around that, and I'll defer to others on how to do that, but if we can turn around that and change the decision to the sort that we know people are pushed toward making, then I think we'll have a better outcome. But that's part of the hard problem, is that because the misinformation that you all just talked about, people are approaching this with exactly the wrong perspective.
Can I just jump in on that too? I mean, it's sort of what you just said. It sort of highlights sort of the risk aversion factor, right? That folks might not be entirely logical about, and yet I would assume the data would show that these are, to a large extent, the same folks who had zero risk aversion when it came to the virus itself, and refused to wear masks, and somehow that calculus. So I'm speaking at this point, I have to admit from personal experience with family members, that finding a logical thread that connects their decision making and evaluations throughout each stage in this pandemic is close to impossible.
Yeah, I think part of that, though, is the commission omission distinction. So if I do the vaccine, if I take the vaccine, I'm the one who's making the choice to get it, and I'm the one that would be responsible for the negative consequences if I have thereafter. Whereas it's somebody else's will or nature's will or God's will if I get COVID.
Right.
And we know that people really don't like commission acts where they can later regret an action they take. They're willing to take on a lot more risk if it's just randomly determined.
That was a very fascinating discussion, very insightful. So we're going to use that when moving on to our next question, which asks, like, what kind of barriers might exist for individuals to access and consume accurate scientific information that's required for this decision to receive the vaccine or to deny?
I'll jump in here. In my field, there's a lot of discussion happening right now about this idea of digital literacy. Literally, as part of the curriculum that we might see as early as elementary school going forward. And a lot of what we've witnessed over the past couple of years, not only in relation to COVID, but in relation to the election, et cetera, is highlighting the importance of training people to be better navigators of what has become a much more complex news and information ecosystem. And so it's a solution that we really do have to think about generationally. Folks who are, who are 70 plus and are, over the past 3 or 4 years have just begun to find their way through social media and YouTube and that sort of thing. It's a very challenging environment for them, and they were not, effectively prepared for it, and we're seeing a lot of the consequences of that. That ability to know how to go about doing the necessary work to evaluate the credibility of sources you're being exposed to, that's very new terrain for many people. And who don't know what resources might be out there. And especially frustrating is that some of the available resources are themselves being undermined by misinformation. And here I'm talking about sort of the fact-checking organizations that have tried to play a very useful role in this space, who are themselves now being subject to being mischaracterized as being partisan this way or that way. So, it's there's sort of, digital literacy skills and knowledge barriers that I think are a very significant problem here.
And I'll jump on that. Overall science literacy in this country is not where it needs to be. And then we also have to think about just average literacy. At what level, at what grade level can the general public really read and comprehend materials that we give them? And Dr. Sharma can speak to this. I walk out of every clinic visit with a doctor with a stack of paper like this, right, from my note summary. I have a PhD, so I feel confident in being able to read and comprehend all of that. But is that true for every patient? And so these are things that we certainly need to think about if we're trying to help people understand why it's important that not only you get a vaccine, but that your friends and neighbors need to get a vaccine to help protect those who can't. Then that's going to require an educational effort.
Yeah, that's great points. I think another facet of it, and something that I've been reflecting on over this last year, is how critical it is that all of our health profession students have really robust teaching and assessing evidence. And that, just because there's a new observational trial, that doesn't mean the better done randomized study we don't need to pay attention to anymore. And against my better judgment, I engaged in a Facebook conversation with someone I went to high school with, who's a speech therapist now, and had access to the literature and was citing a study, which I felt like was she was misinterpreting the punchline of it. And I pointed it out to her, and actually pointed out that these same authors had a follow-up article saying that they felt like the public had and other professionals had promoted the data and their findings in a way that wasn't consistent with their own reflections on it. And she felt like that the authors must have been pushed into publishing that because they felt like they were going to be shamed by their own profession. And I was like, how can you not even believe what these people are saying about their own work? Which I think goes back to this tribalism. So I think all of these things are intertwined, and it's going to be a multifaceted effort.
Yeah, I want to echo something just said. I think it's going to be a multifactorial problem. There are going to be some people who don't have access because they literally don't have access. You have other people who don't understand the literature and et cetera. But there's also some very intelligent, high-functioning people in other aspects of their life who simply choose not to get a vaccine. It could be because of tribalism. It could be because of sort of this purposeful misinformation, like in your conversation with your friend. It could be for other factors. And I think one of the things that's really, really striking, and it's really, really critical for us to remember, is that other people don't just need more information thrown at them to make a good decision. That backfires in many cases. And I think one of the biggest challenges in many, many areas is just trying to figure out how do you change the decision situation so that people can maintain their self-identity and still make the decision that's better for themselves and the greater good. And that's what I see is really hard here. It's not going to be just one simple solution by giving them the right information.
Yeah, I think that's a great point. That reminds me of, I don't know if you're familiar with Dr. Chris Bale's work. He recently had a paper that was essentially, when you present people with like the direct corrected fact, it's unlikely to change their opinion. That brings us kind of to the point where I think that's a great segue, because clearly we're seeing these decisions as not perfectly straightforward, and that there's many factors beyond just a simple risk evaluation of the COVID vaccine itself. There's a lot of external perceptions and ideas that go into these decisions. So let's move and start talking about like what else comes into play with these decisions to get vaccinated beyond just the risk assessments, like what belief systems or perceptions or ideologies influence people's level of confidence? Hard question.
Well, I certainly think that what you're hearing from your circle or from your pod, if you will, or what your social media circle is it has a strong influence. So I'll share my own family member story. I have a family member who is a healthcare worker here in North Carolina, and tried for several weeks after she found out my parents had their first appointments made, tried for several weeks to convince them not to get their first shots, and kept sending them articles. And her argument was they haven't done enough research. And so, yeah, that's, which is, I just don't know, there's nothing else to say really about that, but, from whatever her circle of family or other family and friends, that was a decision that she had made, and she was trying to convince other people of that.
Yeah, I feel like that is one of the most challenging situations when people are really not willing or interested in even engaging in conversation. I feel like otherwise, being willing to just sit down and talk to people that you care about and are in a relationship with, whether it's like your neighbor or your community member, your patient, whatever, and being willing to hear their stories and kind of work through the questions with them is hugely impactful. And I think also that ends up affecting kind of the public health messaging too. Before this, I was at the Department of Medicine Grand Rounds today, and they were talking about how a lot of nurses had been reticent to get COVID vaccination. And when they sit down and talk to them, there were a lot of questions about fertility. And if that wasn't even addressed as part of the public health messaging, then you aren't going to capture that audience, which is a hugely impactful audience, both for the delivery of healthcare, and then nurses are, incredibly trusted and impactful in health messaging in the hospital and in the community.
Yeah, absolutely. One of the things that I think about, or at least there's some of the conversations that I've been having, is a level of trust, not just within like medical systems being a difference, but also a trust in the private institutions that are also part of this vaccine ecosystem, such as pharma companies or technology companies that are trying to have flyers and messaging things. I guess I'd like to go to Dr. Napoli here. As far as these I wondered if you had any thoughts about how these private entities are trying to earn trust. I mean, I think we see that this certainly with tech companies who are increasingly facing scrutiny from changing administrations, but I wondered if you had thoughts about how these companies are trying to shift their PR and earn public trust.
Sure, and certainly what the tech companies have been trying to do and not being wholly successful, but I mean, COVID represented a huge turning point for how aggressive the tech companies were going to be in sort of their, in embracing social responsibility as part of their operating model. So it really did represent a dramatic change, forced them, to rethink what they were. And for those who, and so at the same time, we're talking though about all of this kind of medical misinformation. The amount of misinformation and conspiracy theories that are flying around about how these platforms operate is a whole nother stream of information that folks are consuming about about how YouTube's algorithm operates, and how that these platforms are sort of systematically trying to hide the truth from users, and that it's so this is that intersection now of the medical misinformation with the misinformation about the platforms are and are not doing and what does in fact motivate them creates an environment that is very problematic as far as, and cannot emphasize, these platforms have done themselves no favors in terms of how they've operated over the past decade or so in terms of generating the kind of public trust we would like them to have at this particular moment when they are becoming more empowered and more aggressive gatekeepers than they have been in the past.
Yeah, that totally makes a lot of sense. I think that I've heard people agree that there's this level of trust of the medical system, trust of the information, and then trust of the information providers, whether that be physicians or a digital platform, for sure.
I mean, when the that's a key way of boosting the appeal of medical misinformation is to tie it to, see this before Facebook takes it down, read this or watch this before YouTube takes it down, and then it layers on who degrees of urgency and sort of layers of distrust of certain institutions that you're able to capitalize on.
Well, and something else that I've also wondered about too with the COVID pandemic, and then also more medical misinformation in general, is what is the role of those physicians and other healthcare providers who advocate for conspiracy theories? Because I think it was Pew Research Center did a poll, I believe it was in 2018, on how Americans perceive information. And in that poll, physicians and other healthcare providers remain one of the most trusted sources of information. And so when there are people who have, MDs or doctor of public health, when those letters come behind their name, I really wonder what effect that has on how the public views what is accurate and what is inaccurate. I don't know if Scott or Poonam want to add to that.
Yeah, I can jump in because I think this is just fascinating. If you think about what we evolved for, we evolved to deal with information sources from a very small set of people with whom we interacted on a regular basis. Like we would talk to people in our local unit and we see the same people over and over. And if there was a person who had a extreme view, there's a lot of other people as a buffer. And until 1993 or so, more or less, that's what happened. As Phil mentioned, there's gatekeepers, and the gatekeepers were offered experts or at least experienced people, and there were sort of buffers to this. Starting in the last 20 years, we now have the ability to have very small number of voices amplified, and there isn't the natural buffering that you would have if you had repeated interactions with somebody. If somebody tells you crazy wrong stuff repeatedly, you discount them. But now a single crazy statement can get to millions of people very quickly. And I think it's one of the most fascinating parts about this whole misinformation is that I think it puts us all in a situation that we're not evolved for. We're evolved to deal with repeated again conversations with the same people. We judge their reputations, we decide if they're trustworthy and so forth. And instead it's just fact free floating. And probably there's human bias to be trusting, and that gets us in trouble in this context.
Yeah, I think it's interesting as well. And thank you for sharing your expertise and for raising the question. I mean, from the physician perspective, it's supposed to be a self-policing profession, right? These are why there are medical staff committees and the medical board, at the state level, so that we hold each other accountable. And certainly, good doctors can disagree. There's lots of gray. But to your point, there are some things that are clearly beyond the line. And as a profession, I think we need to hold each other accountable for. On the flip side, on like the social media standpoint, I think it's kind of horrific when you see doctors trying to promote things that are actually rooted in fact and good advice, and then are subject to just enormous amounts of trolling. And that is, just terrible. There are people who are putting in this effort to try to spread good information, hopefully to balance out some of the trash that's out there. and then suffer an emotional and time toll for it.
Okay, great. Well, that was a very multifaceted discussion in relation to Megan's question. So now that we've kind of talked about all the factors that are involved in this decision to receive or deny the vaccine, we wanted to ask what kind of initiatives or approaches have you seen or been involved with which appear promising? And those can be related to either combating misinformation or directly encouraging vaccine confidence through other means. So in other words, how do we fix this problem moving forward?
I can jump up with one idea, and I should say I do not have experience with vaccine specifically, but I'm pulling from other areas. I think one of the biggest missteps, speaking if you can say as a misstep for whole society, has been the lack of connecting the vaccine to anything else. So you think about it, I've been looking forward to 2 weeks from the day for my second vaccine, so my wife and I can go out to dinner for the first time in a year, sitting socially distanced outside. I connected the vaccine to some consequence. But in our messaging, a lot of it has been, even after you're vaccinated, continue with all the things that we do know reduce public health risk. And it probably is the case that we'd be better as a society if we all continue with the same level of precaution after being vaccinated for some time until we are. That surely is good for public health. But I bet it actually costs us vaccine uptake. That if we linked vaccine usage, when you get vaccinated, then you can do these things you couldn't before. Then that suddenly makes the act of getting vaccinated a direct benefit to people. And I think as soon as that happened, if that happened, a lot of the resistance would drop. But as of right now, I think a lot of people see the act of vaccinating as having no bearing on what they're going to be doing over the next year. And they don't actually care that much about the difference in their risk. And so I wonder if there's some way we can actually tie vaccination to something. And I'll defer to others with more public health knowledge of how you can do that.
I wonder though too, this goes back to what I mentioned before, to what extent the folks, the 1 in 5 or whatever is that are not planning on getting vaccinated. I think a large portion of those folks are also the folks who haven't, to the extent that haven't really adjusted their behaviors. That these are the folks walking into the store without a mask still, that these are the folks who are eating in restaurants when, to the extent that it's allowed. And again, I'm speculating here, but I would suspect that there's a strong correlation there. And so I think for some folks, it still takes us to the same place, which is they don't see the vaccination as a gateway to meaningful change in their life.
Well, Krispy Kreme is giving everybody a donut.
I'm getting that donut.
I've not gotten mine yet. It is interesting, and I believe several other companies have done something similar. I've heard that companies, I think, are offering tax incentives. So I'm a fitness instructor for the Y, and they're offering a tax incentive if you if you show your vaccine card. So those are things that I've seen.
Jamie, did I hear you right? You're a fitness instructor at the Y? Oh, so many multifaceted skills. Wonderful.
That's
yes,
the other side of the equation from the donut, clearly.
Yes, of course. Of course, I did have to stop in November because I was not going to be teaching polar bear Pilates. So
that's awesome. I would echo a bunch of the things that were said. Hindsight's 2020. Looking back, I wonder if better messaging around some of these things would have resulted in less vaccine hesitancy. And to offer a different perspective, for those on Twitter, Dr. Kimberly Manning at Emory tweets from Grady Doctor, and she has a whole series of discussions that she posts about conversations that she's engaged with patients or members of her community about vaccines, and often people are hesitant and kind of how she navigates that. So that has been an inspiration and role model for me as I try to have these conversations myself.
And I'll go back to something that Scott said that I have to keep in mind a lot is that we can't fact people to death. that it just is not going to work, and that we really have to, if we're trying to understand why why misinformation is spreading, and we have to try to understand why people gravitate towards it in the first place, and really try to understand what is it about something that attracts them to it, and then what is their rationale behind that. But just saying, describing how an mRNA vaccine works is probably not going to do it. And I have to keep that in mind every day.
Going back to, Megan referenced Chris Bale's work, and he pointed, one of his key points is that, some of the technologies and platforms that we rely on, that we think of as things that we rely on for informing ourselves, that in reality, the driving motivation is identity construction and identity, so the people are, we're kidding ourselves if we think somebody is using, as much as someone might say, yes, Facebook or Twitter is one of my primary sources of news, that's why they're using it, is more often than not probably incorrect. And so, we have to recognize that's a very different dynamic from maybe why somebody sat down to read the newspaper in the past, or sat down in front of a television newscast.
Dr. Napoli, I want to probe you quickly here. Just thinking about like solutions wise, I think a lot of people on both sides of the aisle are concerned about social media regulation in general and misinformation and like shutting down people's voices. You talked about gatekeeping. What do you think that technology companies or maybe government should be doing in that kind of like tech policy ecosystem to make them better at preventing this like widespread misinformation?
I think that the technology companies have, within their First Amendment rights, and certainly within their rights under Section 230 of the Communications Decency Act, not to get super wonky here on everybody, to engage in a lot more gatekeeping authority than they currently do. So what I'm getting at is, I would actually love to see them, and take a much narrower view, so to speak, of what their mission is as a platform, and be, imagine the sort of impact they could have if they said, look, we're going to rely on some sort of third-party entities that make evaluations of the accuracy and reliability of news organizations and information sources, and we're only going to allow those who perform within this particular score range distribution on our platform. It could have an interesting disciplining effect on certain news organizations and lead them to alter their behaviors. It could certainly leave some off by the wayside, and that would certainly, and those would still exist online, and they could still exist on the web, and nobody's First Amendment rights are being violated. As much as we hear people try to conflate, apply a First Amendment standard to the decisions of the platforms, which is something, the First Amendment has no bearing on what an individual privately owned platform does. So I think, but that's, and that goes to the issue of the fact that this is an ecosystem-wide problem. I mean, there's been research that has shown, for example, that in communities around the country where viewership of Fox News is higher, mask-wearing behaviors are lower, and coronavirus spread is higher. So we have sort of macro-level effects research showing, and so the point being, to the extent that any type of news organization to some extent now relies on platforms, at least in part, for their reach, these platforms have an opportunity to influence the behaviors of the news organizations that they distribute, and influence even the privilege, the availability of the privilege of that kind of distribution and algorithmic amplification. And that, again, that's an extreme example, but again, there's still nothing preventing in our current ecosystem new platforms from sprouting up. If you don't like Facebook's policy, go to Parler. Parler's back. And if we have a more competitive and fragmented social media environment, that's probably ultimately for the better, for other reasons. So I could go on. I'll stop.
Yeah, that makes sense. Sorry, I'm not going to derail the conversation too much, but I have one follow-up to that. How do you think that this kind of distribution scoring system would differ from the existing fact-checking systems that we have in place, where platforms like Facebook are already using third-party systems to do fact-checking? How would the scoring distribution differ from what's existing currently?
Well, I think, first of all, the investment in that space needs to be much greater. If you the fact-checking organizations themselves have been very vocal that sometimes they feel like they are there for, political effect rather than to have a meaningful impact. So I think, if you better resource those organizations, expand their mandate a bit, and make decisions about what sorts of outlets do and do not gain distribution on the platform, rather than trying to operate on this constant whack-a-mole model where the decision-making is oriented around the individual post, which I think is nuts at this scale. That this oversight board that Facebook has is there to adjudicate decisions about whether this post should or should not have been allowed. I think we have to kick it up a notch to the level of sources. What we saw with President Trump, for example, that is someone who has been deplatformed. It's within their rights to deplatform individuals and organizations, and I think I haven't heard too many people say that that was a deplatforming decision that has had negative consequences rather than positive consequences. So, but again, it's important, I think, that these platforms, to some extent, delegate that decision-making to some sort of collective, because, I don't think anybody really wants Mark Zuckerberg or Jack Dorsey individually making these decisions about who does and who does not have right of access to these platforms.
Got it. That's really insightful, and that makes a lot more sense. I'm going to bring our conversation back towards the rest of our panelists. Sorry for the tangent. So we know that many in our audience are having conversations in their own circle, especially we've talked about, the scale of people who are struggling with these decisions. And so we've talked a lot about how people make these decisions, the factors that go into it, and kind of different approaches. So what advice would you all have for people who are having these difficult conversations with friends, families, like partners?
So like at least some of the panelists, I have some family members who expressed reticence to get it, and now things are opening, they now have the opportunity to. And I think the most important thing that I've been trying to tell people is the science supports it. So I say things like that, but then I don't go deeply into the science because that leads to reactance. And then I say, you'll feel a lot better after you get it. You'll feel a load of relief once you get it. You will realize that your risk is lower and so forth. And just get the idea of thinking of that moment in time as being a good thing rather than a bad thing. And so far, I think that's had at least some success. I have not tried to engage with anybody on challenging their sources. I've never found that to be particularly useful in any argument with people. So I try to just focus the moment and say it's a simple thing. You'll feel better after you do it. Won't you be glad when you have it done? And use language like that.
Yeah, I would 100% echo that. I'd say don't get into arguments about it with people. If you're arguing, then it's not going to work. It has to be a conversation and asking people if they're willing to discuss it, and then go there wherever they go. And honestly, I think it's a rare person who's hesitating to take the vaccine because of some technical detail of the science. It's an emotional decision, and being willing to go on that emotional journey with people, I think, goes a long way. And then I have just been very proactive about celebrating when people get vaccinated. So for example, it's terrible our last panelist couldn't be here today, but so awesome that she got vaccinated, right? And I think making those celebrations visible and being willing to share with people your enthusiasm for them getting vaccinated and your celebration of the hope of their improved health. I think being willing to share that with people is helpful.
Let's jump in, sort of speaking of experience with, as we're talking about family, in my situation, I have family members who, again, never perceived a health threat in the first place. And so the vaccine, so there, I'm at the, well, guess you're not going to be seeing your grandson for a I don't know, there's no conversation to have, the science is not an issue. There's, if they didn't perceive a threat in the first place, there's just no way of creating any other incentive system to get vaccinated. And yet, so, it's sort of a zero tolerance policy that I have at this point.
That has to be so hard, Phil. Yeah, I would echo what everyone else is saying. I could tell you that my parents took more of the non-engagement route with their family member. Just didn't question sources they were being sent and said, this is our decision, we've made it, we're content with our decision. And then like Dr. Sharma said, I celebrate when my friends and family get their shots. And I really also, when I think it was Dr. Barber who got his shot a week or so ago, and he posted his experience on Twitter, but his reasoning behind it was just, I felt so beautiful, because he said, I do this for the love of my neighbor. And that's what I have tried to promote when I, post stories about the vaccine, is that idea of we're all in this together.
I guess one other thought is sometimes the conversations don't go the way we want in the beginning, or sometimes people just aren't willing to engage, but trying to remember that doesn't mean like this is over forever, right? We have long-term relationships with people. And so being willing to check in with them in the future, or letting them know that you're a resource and can, you care about them and are happy to talk to them anytime and help them, I think is important. So it doesn't have to be a one and done.
Let me just interject here. I know, Dr. Hutel, you have to head out. So I just wanted to say thank you for joining this discussion. We really enjoyed having you.
Thank you all. I've really enjoyed it. I'm sure the last few minutes will go well too. See you guys.
Okay, so now we're going to progress into the concluding question, and then we'll go into the Q&A. So our last question rolls around addressing the symposium participants directly. So most of the participants are undergraduate students and will likely encounter medical misinformation and its negative consequences, as we discussed, in their careers. So as experts, what advice would you give to students looking to combat misinformation in their future research endeavors?
I think we could also take this question as far as maybe not even necessarily how might they personally deal with it, but what kind of career options can they leverage towards this problem, if that helps to broaden it a bit.
Interesting.
We've stumped you.
Well, that's just such a big question. And I also think too, one thing that I've noticed with COVID is really just sort of this upsurge of awareness of misinformation. It's not that medical misinformation wasn't out there, certainly before COVID came to our lives, but now there has just been this huge push to try and address it. So I do think, as I mentioned earlier, I think first step is preparation. Just know that whether you go to become a medical professional, or if you go to a PhD route, if you go take anything into the sciences, and also probably just by being human on social media, you're going to encounter misinformation. And so you have to make the decision of how you want to address that or not. You have to make the decisions of how you want this to be a part of your life. And I think once you have sort of that route decided, then you know the concrete steps going forward. But I'd say that would be the first decision.
I think that's good advice. I think, particularly in the sciences, it behooves everyone to be a skeptical reader of the literature and being willing to question what you read and recognize that science changes. So just because we're saying one thing is the best today does not at all guarantee it'll be the same thing next year or in the COVID era, even next month or next week. That is what it is. And then in terms of career, I think pick a career that you're passionate about, and medical misinformation or misinformation is generally such a problem. If you're passionate about this, I'm confident there'll be some overlap.
I'll just speak from the perspective of the incoming administrator of our journalism certificate program here at Duke. I would love to see this year have the same kind of effect on students thinking about pursuing journalism careers as, you know, the Watergate had. I mean, Watergate created a huge bump in applications to journalism schools. And I think one of the things we've learned over the course of this past year is the importance of, and again, particularly at the local level, keeping people up to speed on what are the developments in their communities, being able to be data savvy as using data to report accurately, reliably, timely manner. So, I think, there's such a strong need, will continue to be this need going forward for people who have that intersection of journalistic skills and scientific knowledge. I would, the economics of journalism are brutal these days, but I think that's also something we're starting to see, change, and that we're starting to see recognition even within the policymaking sector, that this is a public good requiring public support in this country to the, in manners similar to what we see in other developed countries. So it would be nice if in the end we can look back at this pandemic and say, wow, at least it helped us sort of rebound, in terms of providing the necessary support for our news and information ecosystem that's been declining so badly over the past decade and a half.
Yeah, absolutely. So now we'll open up for Q&A, and we have Gayatri coming, and she will be moderating that.
Hello. So as far as Q&A goes, so there's two questions right now. So one is from Mike, and he's asking, I wonder what % of doubters are mistaken about the consensus of experts about an issue. Two, despite that they disagree with the issue. Or three, basically accept and perhaps have a policy that caused them to disagree with the policy. So I think Mike is asking, correct me if you're wrong, asking if doubters are mistaken about a consensus and disagree with the policy that some experts have.
I wonder what kind of policy that might be referencing. Like, would that be a policy of the public health institutions that's determining like who gets vaccinated? Or is there another lens of policy? I don't know.
Yeah,
Mike can come and clarify. Or if anyone else would have better understood that.
If I understand the first part of the question, I think one of the things that I've observed, again, sort of anecdotally, is that everyone does have their, I'm not gonna lie, I have had the arguments with family members who are adamant that they are getting information from reliable public health experts. That person with the video on YouTube and with the letters and the degrees after their name is a reliable source for them. Now, of course, that source is telling them exactly what they want to hear. And so, the evaluation of the credibility of that source goes no deeper for that reason.
In terms of a percentage, I don't know that I've not seen any data that would sort of dig into, exactly, reasons behind, well, I sort of accept this. I sort of accept, yes, COVID exists, but no, I don't want the vaccine for these reasons. I've not personally seen that data. I don't know if, Dr. Sharma, if you have. But I would say there are certainly there are certainly multiple reasons why, in terms of the COVID vaccine, that someone would not want to get it. And it could be, it could range from, it's too new, it's been pushed out too soon, there's not enough research that's been done on it, I just want to wait and see. There are multiple reasons within that vein.
Right. So we're having another question coming up, and it said, too bad he is no longer here, but I really like Dr. Patel's comments on trying to get the vaccination for a specific benefit. And the question is, do you think public health officials have already failed at that with the constant moving target from 2 weeks to slow or flatten the curve to now over a year of lockdowns, and then many politicians who are enacting these rules shown violating their own rules? And for example, the back and forth between Fauci and Jim Jordan this week.
I didn't see the back and forth, so it's hard for me to comment exactly on that. I do think a year of living in lockdown, more or less, has been an incredible toll on everyone. That said, I don't think the question suggested that maybe we've missed the boat and it's too late. And I'm thankful to say I don't think that's the case. I think the increasing availability of vaccines hopefully will give this new momentum and enthusiasm. And I think this is really an important moment in history to try to capture that.
I think one of the things that's frustrating for people is, in terms of talking about things always changing, is a generalized lack of understanding about how the scientific process works. And we talked, the mask example was brought up, and it's a perfect example, because for the CDC and to come out and say, well, we don't need to wear masks, and then a few weeks later to say, no, everybody now wear masks. It's very easy for the general public to have the view of, why can't anyone make up their minds? Why does everything change? If they don't have the understanding of that's exactly how science should work. And so I think for those of us who are trained in science, this isn't unexpected for us, that we should have moving targets, and it's not unexpected. But for people who don't have that understanding, of course it's frustrating. And if we could somehow find a way to work or up the general science literacy, at least on that end, then I think the next time something like this happens, it might lower the frustration levels, but that might just be wishful thinking on my part too.
One thing that makes me think of, Jamie, is, two thoughts. One, I feel like COVID in general obviously there's the new virus, which has caused so many problems, but in so many ways, COVID has just exacerbated problems that were already there. And I think we see that in kind of science literacy, as you're alluding to as well. I also feel like there's that, the other thing comes to mind is there's that notorious medical school quote about how 50% of what we're teaching you is wrong, we just don't know what half. And that quote has played out to the general public over the last year, and the time course of that has just escalated dramatically. We used to think of that playing out over the course of decades, and now it's been playing out over the course of weeks and months. And I think just the human mind, asking anyone to wrap their head around that is a challenge.
Well, and now we have it in the context of the social media landscape, where as soon as something is said, be it from the White House or from the CDC, it's sent around the world in a matter of hours. So then to go back and try to recorrect or readjust in 2 weeks, which again, and like you just said, in the time of COVID, when it's so fast moving, which would be perfectly normal, now just everything is just sort of hyped up, and it's been a challenge all the way around.
Well, two more questions actually. Keep asking people. One from Aaron Sherman. Offering potential clarification, masks or location tracking via like phone software might feel unacceptable even if protecting public health is an agreed upon positive goal. Is that a solution dispute or is it a problem dispute? As in like solution dispute as in I don't like this like tracking on my phone versus like problem dispute as in, hey, COVID isn't that big of a deal.
I don't think it's an either or. I think it depends on I think for some people it is one, some people it is the other. I've heard both. I mean, there's people out there, for example, who still adhere to the belief that masks don't work, and therefore, and then on the other hand, there's also people out there who believe that COVID isn't particularly contagious. I've heard those same two beliefs expressed by the same person.
Yeah. Last question so far. Gautam Chabrolu asks, hi, I asked the second question as a quick follow-up. I agree there's a large disconnect in understanding the scientific process, and that is something that has to keep updating. I do see a bit of hypocrisy because so many of my peers who are scientists and PhDs and doctors are constantly saying, trust the science. One example would be the outright denunciation of hydrochloroquine after the Lancet article came out and then it being retracted a few months later.
I think that's a reality and it makes it really hard. And I just feel like it's not because science is perfect to say trust the science. It's just because there's no better option. If there was something else that we could rely on, that would be awesome. But at the present moment, the science is the best thing we have.
I think part of that goes to the way too how journalism covers science, and I think sometimes a warped or sort of hyperbolic approach to reporting on science has been problematic over the past year or so. I mean, we'd like to see the same kind of measured approach to reporting on science that we hope science takes in reporting on itself and its own findings, but I don't think we often get that.
That's a great point, Phil, and I would echo that. And again, I would say that at least if I would tell someone trust the science, I would also, I think, want to say to that, trust the process as well, which is a self-correcting process. You mentioned the Lancet article in the question, it just reminds me of, the fact that Andrew Wakefield's article on the MMR vaccine being linked to autism was also published in the Lancet. It was retracted, but in that case, it took 10 years for a retraction. And of course, certainly we're all now living with the consequences of that still. But in this case, again, I think we're just seeing everything. We're still seeing that self-correction is just being accelerated. But again, just what's also accelerated is just the like you say, as it gets reported, the perceptions, the reporting is accelerated and the perceptions of what that means and the interpretations are also accelerated and that leaves the potential for misinterpretations as well.
Great. So I'd love to take a moment and thank each and every one of our panelists, along with Gayatri for moderating that Q&A. We know it's a very busy time for everyone in the semester, and we're just incredibly grateful for your contributions to the discussion and the insight that you brought to this panel today. For the symposium participants, we hope you learned something new about how to combat COVID-19 misinformation in your own lives or anything along those lines. In order to close the event, I'm now gonna pass it off to Professor Housekeeping, who's gonna say some closing remarks, but thank you again for listening. You have a great day.
Well, I've had the pleasure of being the faculty advisor for this event, which has been a totally student-run and generated event. Most of the students in the Huang Fellows program who've organized this event have never done anything like this before. And we did it on a schedule and in a format which is almost possible to imagine would have been successful. And I think it was just extraordinary. The keynote speaker, each of the panelists, the questions, and the manner in which it was conducted was just actually wonderful. So congratulations to Rithik and Megan and Alex and Gayatri and Ala. Just a wonderful job by all of you. So thanks so much for your efforts. And on behalf of the Huang Fellows Program and for all those who got to listen. So congratulations.